Welcome back here. U.S. health officials are expected to recommend that all Americans get a COVID-19 booster shot.
Yeah, and there's new data on vaccines for expecting moms. So we were chatting about all of that and more with Dr. Jill Foster, a pediatric infectious disease physician with the U of M Medical School. Good morning, Dr. Jill. Thank you for being here.
Good morning.
Okay, let's first talk about the booster shots. We've been talking about it a lot over the last couple of days, specifically today as well. We know that they have been recommended for those who are immunocompromised, but now it looks like that's going to broaden out to almost everyone eventually. Can you explain what is a booster shot? How does a booster shot work?
So the first two sets of the vaccine you get really sort of introduces your immune system to the virus, and then you produce antibody. So one of the things that we're starting to find is that antibody starts, decreasing over time. You get really nice levels in the beginning, and then it decreases over time.
And I think that's kind of what we're talking about next here, because the reality is, are we concerned that our current coverage from those first two vaccines actually goes away? And I guess I'm curious about the timeline of how we know how many months until it does go away.
Well, I think we get two things going on. Is the antibody levels go down low, plus the Delta is needs even higher levels. I kind of think of it as a fire. If you got a little fire, a garden hose is going to put it out. But if you got a forest fire, you need more something like a fire hose. So Delta is kind of more like a forest fire than the early COVID we had was more like a little brush fire. And so even more so now we need that high antibody level. And our antibody levels in the beginning were a good fire hose, but now they're kind of down to more like a garden hose.
So obviously with the disease changing and the different variants, and now we're talking about Delta, but who knows what we'll talk about in, I don't know, 3 months from now, 4 months from now, frankly. Does that mean like we will constantly just need booster shots?
No, I don't think so. I mean, we found that the antibody works fairly well against, with a lot of Greek letters left, we've got to go through here. So I think that it's just about keeping that antibody level high. Maybe 6 months from now, a year from now, or even sooner, we'll come up with sort of an antibody that matches the virus a little bit closer than the one that was circulating a year ago when these were developed. But, a lot of it really comes to how much antibody have you got, like how much water are you spraying on this fire.
Interesting. Okay. Dr. Jill, let's talk about this new data that's coming out about the vaccine and pregnant women. So
Yes.
What do expecting moms need to know?
So I think people have been very worried about the vaccine. I mean, the vaccine so far we're finding, has very few safety problems. But what we do know is that COVID in a pregnant woman, both for the health of the pregnant woman and for the health of the baby, women are having severe COVID, are ending up very, very sick from COVID, and so are the babies. More premature births, the babies are having a lot more problems if they actually get COVID. So the best thing to do here is really get that vaccine and prevent women from getting COVID while they're pregnant.
Let's talk about the school year. We know fast approaching. The state is asking kids to mask up in school this fall. I would imagine a lot of families are asking you what they should be doing, how to approach this new school year. What are you recommending to the families that you're talking to?
Oh, absolutely, masks. It's a little bit tricky because, it's hard, depending on the age of the kid, to try to get them to wear the mask and wear it all day. But again, back to Delta. I hate to always be talking about Delta, but Delta just transmits from one person so much more easily to the next person, and that anything we can do out there to try to prevent the kids from breathing in COVID, especially if we can decrease the amount that they're breathing in, masks are really the first line for this, especially in kids who are too young to get the vaccine.
Do you think kids, too, who are maybe eligible for the vaccine, should they still be wearing a mask in school, do you think?
I kind of look at it like it's raining outside, and you take your umbrella and your raincoat. And back to Delta, it's like we've got a hurricane now instead of just a little bit of a rainstorm. So the more that we can do to protect ourselves, masks, vaccine, and avoid big crowds where, especially in rooms that don't have good ventilation in them. It's all about not putting yourself in close proximity to that virus.
Yeah, makes a lot of sense. Dr. Foster, we appreciate that you're sticking around.